Christine Brousseau. You may begin.
Okay, thank you. Thank you, Madam Chairwoman and the members of the committee. As an obstetrician, I can appreciate a late night's work, so I will certainly try to be brief. I am testifying in opposition to 7854. I'm a Rhode Island obstetrician and gynecologist and the legislative chair.
Your red button should be up.
It is up, okay. I'm a Rhode Island obstetrician and gynecologist, and I represent the legislative chair for the American Congress of Obstetricians and Gynecologists, more commonly known as ACOG. ACOG represents 58,000 board-certified OBGYNs in the country and is considered the nation's leading source of evidence-based medical treatment for women and their reproductive health. Induced termination of pregnancy is one of the most regulated medical procedures in the United States. ACOG recognizes that the issue of abortion is a matter of profound moral conviction and continues to affirm the legal right of a woman to obtain an abortion prior to fetal viability. Partial birth abortion is not a medical term and is vaguely defined in the law. The potential exists that legislation prohibiting specific medical practices may outlaw techniques that are critical to the lives and health of American women. I encourage all legislators to read Judge Ginsburg's dissenting opinion of the 2007 Supreme Court opinion, as I think it provides some insight on some of the potential dangers of this legislation. But regardless, federal law in 2003 imposed a nationwide prohibition on what they termed partial birth abortion, and this was upheld by the U.S. Supreme Court in 2007. So this legislation is unnecessary, it's redundant, and it serves only to ignite controversy and emotion. It's incredibly disappointing that given our high rate of unintended pregnancies, we're not working together to increase women's access to health care and specifically to contraceptive services. Early access to care during pregnancy, especially for our underserved women in Rhode Island, could prevent the need for anyone to even seek these procedures. Proven strategies to reduce unintended pregnancy are comprehensive sexuality education, improved access to effective contraception and emergency contraception, and this is where our focus should be. Bringing unnecessary legislation to the table only keeps us returning for annual lengthy hearings that accomplish nothing. Thank you.
Thank you, Dr. Brousseau. And Senator Graciana, welcome.
Thank you. And thank you for having this hearing and this meeting and for discussing the key issues that really are on the table here tonight. I'm going to be very brief because you've heard all of the arguments. You've heard the position of Right to Life. You've heard the position of the opposition. It's going to be up to your committee to determine whether or not you will take a good look at what partial birth, which is a misnomer, by the way. It's never a partial birth. It's a full birth of a live infant who was subsequently in some way or shape discarded. And so I would ask the committee to look very carefully at the requests that you're hearing tonight, and don't make Rhode Island into one of those states where abortion not only can be done anytime, anywhere by anybody, but you're asking the taxpayers to pay for it. And I do appreciate the opportunity to speak tonight, and I thank you for your efforts. Having been in that position, I know it's going to be a long night. Thank you very much.
Thank you. Are there questions from the committee for either Dr. Brousseau